Ever had one of those moments, where everything seems to just slow down, like it's all happening in slow motion?
Mm.
Sirens, rain, maybe a multi-car collision on the highway, and you pull up and you're the first one there, heart's racing. What's the first thing you even DO?
That's what's so amazing about ATLS, you know?
Right. Advanced trauma life support.
Yeah, it really takes the guesswork out of those critical moments. Gives you a system, like a roadmap for action, even when it feels like everything's gone crazy.
And that roadmap is exactly what we're diving into today. We're using ATLS Essentials by Dr.Atef Ahmed
Good book.
to give you all the core principles, even if you never actually, pick up the textbook itself.
And the great thing is, it's not just for, like, trauma surgeons. Dr. Ahmed really emphasizes that. It's for every single person in that whole chain of survival.
EMTs, nurses.
Yep. Everyone working together, like, almost like a well-rehearsed orchestra.
I like that. So let's break this down. Dr. Ahmed, he starts off chapter 1 with, preparation, triage, that initial assessment, the ABCDs.
The essentials.
Right. Seems pretty straightforward on paper, But I imagine when you're in a real trauma situation.
Oh, it's a whole different ballgame. The pressure's on.
Totally. So preparation, that has to start way before you even get to the hospital, right?
Exactly. It's about having the right equipment ready to go, knowing your team, what everyone's role is, and constantly practicing, refining those skills. Dr. Ahmed, he gives this example. Imagine you roll up on a scene, multiple casualties, maybe a bus accident or something. And it's not just about treating the person with the most serious injuries first.
Oh, wow. Okay.
It's about making sure everything you do helps the most people possible.
Triage. That's
Yeah.
no. It's a tough reality of mass casualty situations.
Yeah.
Dr. Ahmed doesn't sugarcoat that at all.
No, not at all. And then once you're at the hospital, that's where those ABCDEs really come in. Airway, breathing, circulation, disability exposure. It's systematic. Make sure you're not missing anything life-threatening in those first few minutes.
You mentioned earlier needle decompression. For attention pneumothorax, Dr. Ahmed, he points out that even paramedics are trained to do that now.
Yep. It can be that time sensitive.
Wow.
Really highlights how ATLS wants everyone to have those life-saving skills.
Absolutely. So the patient is breathing. We've bought ourselves some time. But what about blood loss? I mean, Dr. Ahmed really stresses how vital that circulation assessment is.
He does. And it's not just blood loss. We're talking about shock, too. Hemorrhagic, cardiogenic, obstructive. There's more than one way the body can go into shock. Dr. Ahmed's really clear about that. Each type needs a different approach.
So it's not as easy as just looking for bleeding.
Right.
You have to look at skin color. Are they clearly confused? All those little clues, like you're piecing together a puzzle.
Right.
In the middle of a crisis.
Exactly. And then there's D, disability. Got to do a quick neurological assessment. Are they alert? Responding to questions. That kind of thing helps you figure out, 1, if there's a head injury, and 2, how bad it might be.
And finally, E, exposure. That one seems, I don't know, self-explanatory, get those clothes off. But Dr. Ahmed points out that it's about more than just that, right?
Way more. It's about preventing hypothermia, which, for a trauma patient, can be a huge problem.
Even if it's not, like, freezing cold out.
Even then. Their bodies are working overtime already. They're vulnerable to temperature changes. Even a little drop can make bleeding worse and lead to other complications.
So we're talking warmed blankets, warmed IV fluids, all those little things that could easily get missed when things are intense.
You got it. It's about maintaining that balance. Now, all that, the initial assessment, those ABCDEs, that's just the start. Dr. Ahmed goes into a lot of detail about other things we can use to paint a clearer picture. ECGs, X-rays, fast exams.
He's a big proponent of fast exams, isn't he? Focused assessment with sonography for trauma, he calls them a game changer, especially when it comes to abdominal injuries. What makes them so important?
Speed. With a fast exam, you can see if there's free fluid in the abdomen. That's a major indicator of internal bleeding, and you can find it right there at the bedside.
So it's all about connecting the dots,
Right.
Using every tool you've got to figure out the injuries and prioritize treatment.
You got it. Eliminate the guesswork. Give the patient the best possible chance.
Okay, so we've got the groundwork laid. We know those crucial initial steps of ATLS. That's what happens in those first few minutes after an injury. But what about specific types of injuries? How do you use these principles when you're really in the thick of it, in trauma care?
Now, that is where things get really interesting, and that's what we're going to get into next.
Okay, so we're back and ready to really get into the specifics of managing trauma, using ATLS, of course. And let's start with something I think we've all experienced at some point.
Everyone's had a bump on the head.
Exactly. So a knock on the head.
Seems simple enough, right?
Yeah.
But As Dr. Ahmed points out in Chapter 6, even what seems like a really minor head injury
Right.
can have some pretty big consequences.
So what are some of the most important things that, ATLS teaches us about, first of all, like assessing a head injury, and then how do we manage it? Because obviously it's more than just how many fingers am I holding up.
It is. It really starts with understanding the anatomy, how the brain is protected inside the skull, and any kind of swelling, any bleeding in that space, that's where things get dangerous really quickly. Intracranial pressure, ICP.
Right. And Dr. Ahmed, he talks about how the body tries to like compensate when that pressure starts building up, but there's only so much it can do. So what are some of those, I don't know, like warning signs? How do you know if things are going downhill?
The early signs can be kind of sneaky, maybe a little confusion, some nausea, change in breathing. But if that pressure keeps building, you might see a really bad headache, vomiting, even a coma.
So you really have to catch it early.
Absolutely.
What can you actually do about it, though? Like, how do you manage rising ICP?
ATLS takes a multi-pronged approach. First things first, you've got to make sure the airway is clear. And then you've got to keep that blood pressure stable. Medications to reduce swelling are key, too. And in the worst-case scenario, surgery might be the only way to actually relieve the pressure.
I think Dr. Ahmed even mentions like a procedure where they'll remove part of the skull.
Craniectomy,
Yeah.
to give the brain room to swell.
Wow. Intense.
It's a last resort for sure.
It shows how serious head injuries can be. Okay, well, speaking of serious, let's talk about spinal injuries. Because, that's another area where, one wrong move.
Huge consequences.
Absolutely. Dr. Ahmed, he dedicates a whole chapter to this in the book. So what are the biggest things to keep in mind when you're approaching a potential spinal injury?
Immobilization. That is absolutely key. And from the second those first responders get to the scene, all the way through transport, initial evaluation, you've got to protect that spinal cord from any more damage.
That makes sense. But I know there's been, some debate about using backboards and neck braces. Is there any risk of making things worse?
It's a good question. And the guidelines have changed over the years because of it. But, like Dr. Ahmed says, it's always better to be safe than sorry.
Err on the side of caution.
Especially in those first few minutes.
So, okay, let's say you've stabilized the spine as much as you can at that point. How do you actually figure out how bad the injury is?
You need a really, really thorough neurological exam. You're checking for sensation, motor function, reflexes. Basically, we're trying to map out what's working and what's not.
Right.
Imaging CT scans in particular, those help us actually visualize the bones, the spinal cord.
The big question, obviously, is whether there's any damage to the spinal cord itself. Yeah. Dr. Ahmed describes it as like the information highway between the brain and the rest of the body.
Love that analogy. And when there's damage to that highway, well, the effects can be, they can be all over the map, literally, from weakness, numbness, all the way to paralysis.
So managing a spinal cord injury, I'm guessing that's a long and complicated process.
It can be. It often takes a whole team of specialists, surgeons, neurologists, rehab specialists, everyone working together to get that patient back on their feet.
There's that teamwork again.
Always crucial.
Dr. Ahmed mentions that even something as simple as knowing, who's who on the team,
their roles, yeah,
can be crucial in that moment when things are crazy. Kind of like we were saying earlier, like a well-rehearsed orchestra.
Exactly. Everyone knows their part.
Okay. We've done the head, the spine. What about the chest?
Another vital area.
Yeah. Dr. Ahmed really drives home the point that, well, obviously, it houses some pretty important organs.
The heart, the lungs, yeah.
So A and Y injury there has to be taken seriously.
No doubt. And we're not just talking about, bruised ribs or anything, though those can be painful. But we're talking injuries that can affect your ability to breathe, to get enough oxygen to circulate your blood.
Like a tension pneumothorax.
Exactly. Or a massive hemothorax where you've got blood filling up the space around the lungs.
And that's where, again, it becomes all about time.
Every second counts.
Wow. Okay, so what needs to happen?
You got to be fast. Assess the situation, needle decompression if needed, chest tubes. These are all things that can absolutely save a life. And sometimes surgery is the only option if there are organs that need repair.
Dr. Ahmed also talks about rib fractures. He makes a really good point about how dangerous those can actually be, especially in older adults.
Yeah, it's easy to think of rib fractures like, okay, you broke a rib, it'll heal. But when it's an older patient,
it's different.
Very different. First of all, their bones are just more fragile. and they're more likely to have other health problems that complicate things.
So you're saying like a rib fracture that a younger person might just kind of shake off. For an older adult, that could actually be life-threatening?
It's possible.
Yeah.
They might not be able to take a deep breath because it hurts so much. And that can lead to pneumonia. That's why good pain management is so, so important.
It just goes to show you there's always more than meets the eye with this stuff.
Always. Trauma care is not one size fits all.
It's really not.
No.
Okay. Anything else on chest injuries?
Well, Dr. Ahmed also talks about blunt cardiac injury,
Which is?
damage to the heart, but from like a forceful impact,
Yeah.
a car accident, a blow to the chest,
And that can really mess things up.
big time. And the problem is, it can be hard to diagnose because the symptoms aren't always super obvious, but it can be really dangerous if you miss it.
So how do you even, like, catch that?
You have to be really suspicious. If you've got any patient who's had any kind of significant blunt force trauma to the chest, you have to do a thorough cardiac assessment, EKGs, echocardiograms to make sure there's no damage.
And then treatment. I'm guessing that depends on the injury.
It does everything from medication to stabilize their heart rhythm all the way to surgery.
So we've gone from head to chest, and we're seeing this pattern, right? ATLS provides this system, this like framework for taking action, no matter the injury. So what's next? Where are we going next on our deep dive into ATLS?
Let's talk about the abdomen. Talk about a place packed with vital organs.
And every single one of them can be injured in a trauma situation.
Exactly. And each one with its own vulnerabilities.
All right, so we are back, and we are still making our way through the world of ATLS. We've done the head, the spine, the chest.
A lot of organs to cover.
So many organs. And I know we said this is like a puzzle, but what are we talking about with abdominal injuries?
Well, if you think about it, the abdomen, it's like almost like a suitcase, right?
Okay, I see where you're going with this.
Packed full of all these really important things, but there's not a lot of extra space. And Dr. Ahmed points this out in Chapter 5. He really does, he says, with abdominal trauma. What you see is not always what you get.
Meaning, like, the worst injuries, they don't always have the most obvious symptoms.
Not necessarily, no. So you can't get complacent. You've really got to be paying attention during that physical exam.
And the FAST exams, we talked about those earlier.
Yep. They're really important here, too.
Because you can see if there's internal bleeding.
Exactly.
Yeah.
Free fluid in the abdomen, that's a big red flag. And depending on the mechanism of injury, what else you're seeing on the exam, you might need more imaging. A CT scan, x-rays.
Dr. Ahmed, he even mentioned something called diagnostic peritoneal lavage.
Yeah, that one's a little more old school.
But still important.
In certain situations, yeah. Basically, we're talking about putting a needle directly into the abdominal cavity to see if there's blood in there or other fluids.
Okay, so that definitely sounds like a more invasive kind of procedure.
It is. It's not the first thing we'd do, that's for sure.
Okay, so let's say you find something serious, like there's bleeding, an organ is ruptured. What happens then?
Then you go back to your ATLS training. Those core principles. Stabilize the patient and get them definitive care as fast as possible. So we're talking controlling that bleeding, making sure their vital signs are good, and if they need surgery, we get them into the OR now.
It's kind of amazing, though, right? ATLS really gives you that framework, no matter what the specific injury is. But, you know, Dr. Ahmed also talks about special populations, and it's a good reminder that trauma, well, it affects everyone a little differently.
Huge point. Kids, older adults, pregnant women, they all have unique physiology that you really have to consider when you're managing their care.
Let's start with the youngest patients, because, I mean, treating a child who's been injured.
Talk about high stakes.
Right. It's a completely different ballgame.
And Dr. Ahmed is very clear about this. He says, this is a direct quote, children are not just small adults.
And he's right.
Their bodies are still growing. Their bones are more flexible. Even the way they respond to medications, it's all different.
So when we're talking about children, what are some of those key differences in the ATLS approach?
Honestly, everything has to be adjusted. Everything from managing that airway to giving them fluids. It's all based on their size and how far along they are developmentally. For example, their airways are smaller, way more prone to getting blocked. So we have to be extra careful with intubation.
Wow. It makes you realize how specialized this field really is.
It is.
And then, of course, you have older adults, which, I mean, you were saying earlier how even something as like a simple fall.
Can be devastating. You're dealing with more brittle bones, organs that aren't as resilient, and chances are they've got other health issues already. Makes things tricky.
Dr. Ahmed gives an example, right, of an older patient who fell, fractured a rib.
Yep. And you're thinking, okay, fractured rib, painful, but...
Manageable.
Right. But this particular patient,
Yeah.
because of her age and because she had heart condition, she wasn't able to breathe deeply enough because it hurt too much,
Oh, wow.
which led to pneumonia. And she ended up in the ICU.
It's heartbreaking. But it really shows why it's so important to think about the whole picture, the big picture. You can't just look at the immediate injury. You have to think long-term with older adults.
Think about those potential complications. Absolutely.
And that kind of brings us to another patient population where that kind of thinking is critical, pregnant women. And Dr. Ahmed, he does not shy away from...
How complicated it can be.
Exactly. I mean, you're essentially treating two patients at the same time.
Exactly. And you have to factor in those physiological changes that happen during pregnancy. How's mom doing? How's the baby doing? It can be a lot to juggle.
So are there specific ATLS guidelines for when you're dealing with a pregnant trauma patient?
Absolutely.
Hmm.
Fetal monitoring is standard, and the way we position her on the table during exams, during procedures that might be different too, to avoid putting pressure on any major blood vessels.
Right.
Even something as basic as like giving her fluids through an IV, we might have to adjust that because she has more blood volume now.
It's really amazing. I mean, there is so much nuance to this. It's not enough to just know the steps. You have to be able to change those steps based on the patient, how old they are, what other health problems are going on, all of it.
And that's what's so great about ATLS, right? It's not just a list of rules. It's a framework. It's a system that helps you make good decisions in those moments when it really matters.
No matter what craziness is thrown at you.
Exactly.
This has been incredible.
I'm glad to be here.
Honestly, I mean, this whole deep dive, it's really been eye-opening. I want to give a huge, huge thank you to our expert for walking us through all of this complicated stuff. And to our listeners, thank you so much for joining us on this journey. And until next time, we'll see you on the next deep dive.